If you've been told that joint damage from rheumatoid arthritis is permanent, you've only heard part of the story. There's more hope and more options than most people realize. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health utilizing the safest, most effective treatments available. Today, we're talking about something I discuss every week with patients: joint damage from rheumatoid arthritis. This is a topic that often brings fear, confusion, and frustration. You might be wondering, can I stop my joints from getting worse? If there's already damage, can anything actually help? Or is this just something I have to live with forever? These are smart and important questions because with RA, there is a window of opportunity, a short, early stage in the disease where treatment can dramatically change your outcome. If we catch RA early and treat it correctly, we can often prevent joint damage completely and even put the disease into remission. So let's break it down. What causes joint damage? How can we stop it? And is there any way to reverse what's already happened? Rheumatoid arthritis is not just regular arthritis. It's not just achy joints. RA is an autoimmune disease. Your immune system, which normally protects you, starts attacking the lining of your joints in a condition like RA. That lining is called the synovium. When it's inflamed, it causes pain and swelling, and over time, it damages several different areas of the joint. It damages the cartilage, the cushion between your bones. It can damage the bone itself, leading to erosions and deformity, and even the ligaments and tendons, leading to instability. Think of your joints like the gears in a watch. When inflammation flares, it's like pouring sand into that watch. Everything gets stuck, worn down, and breaks over time. The result? Stiffness, pain, and eventually permanent deformity. But here's the good news. That doesn't have to happen. Early treatment makes all the difference. So can joint damage be prevented? Yes, absolutely. And this is where the window of opportunity comes in. This is a short period, usually the first 6 to 12 months after symptoms begin, where the right treatment has the most impact. If we act quickly, we can shut down inflammation, prevent damage, and put the disease into remission. That's not just theory. That's real-world experience and patient experience. Let me give you an example. Patient of mine, a woman in her 40s, came in with morning stiffness. Her hands felt swollen. Her labs were borderline in terms of inflammation and antibodies, but her ultrasound showed early inflammation in the joints. We caught it in time, started treatment right away, changed her diet, added medication, focused on strength and stability exercises. 6 months later, she was in remission, no more swelling, no new damage, and normal labs. That's the power of early action. So how do we prevent damage? Step number 1 is lifestyle changes, anti-inflammatory eating, strength-based movement, stress reduction, improving quality of sleep. The reality is that medications are frequently appropriate. In most RA patients, medication is needed and appropriate. Exceptions would be if you have no objective inflammation on exam, imaging, or labs. In that case, the risk of progression over the next year is low, and holding on starting medication temporarily is okay. In all other cases where there is objective evidence of inflammation, disease-modifying treatment should be started. Examples of disease-modifying treatment include methotrexate, biologics, and JAK inhibitors. These help to calm the immune attack and prevent progression of disease. When we say disease-modifying, we literally mean taking a condition that, if left untreated and inflamed, leads to progressive damage, to now that damage has completely stopped and the progression of the disease has stopped as well. The next important step is that monitoring closely is important. We don't just go by how you feel. We use labs and imaging to catch damage early. That way, we adjust before things get worse. The bottom line is that in that window of opportunity is your chance to take control of your condition before your RA takes control of you. So, can we reverse joint damage? Let's say it's already been a few years, there's some joint damage, erosions, joint space narrowing, damage to the joint and bone. Is it too late. No, there's still a lot that we can do. Now, we may not be able to rebuild lost bone or fix severe deformities, but we can still reduce pain, improve stability, preserve the function that's still there, and in some cases, promote mild tissue repair. To begin with, utilizing the appropriate disease-modifying treatments is still key here to at least preserve you where you are at that status, to prevent more progression and to stop the inflammation. At this stage, when it comes to chronic damage, this is also where regenerative medicine becomes really valuable. These are non-surgical treatments that use your body's own healing ability. This includes PRP or platelet-rich plasma. This is from your own blood, platelets from your own blood, that are concentrated, injected into the joint, helps to reduce inflammation and support healing longer term. Then there's prolotherapy, where we utilize a natural sugar solution to stimulate repair in the ligaments and tendons, which is great for joint instability and improving stability and function. And then there's bone marrow cell therapy, utilizes your own stem cells from your bone marrow, injected into damaged areas, helps when other options are not working. The Regen Med options are appropriate after your RA is no longer active and inflammation has calmed down. Let me give you an example. A patient of mine, a 65-year-old man with long-standing RA, stable, controlled inflammation on medication, but having chronic pain in his knees and wrists, and that still persists. We use platelet-rich plasma in his knees and prolotherapy in his wrists. Over a few months, he has less pain, more strength, and better movement. He's back to walking every day, and all this without surgery. Now let's clear up a few misconceptions. Myth number one, all joint damage is permanent. That's not exactly true. You can still regain strength and reduce pain even after some damage occurs. We may not be reversing what your x-ray findings look like, but we can significantly help in terms of your daily function, pain, and overall quality of life. Myth number two, normal labs mean you're fine. Nope. You can still have inflammation even when your blood tests look normal. That's why we still utilize ultrasound and physical examination to make sure there's no other signs of inflammation. Myth number three, steroid injections are the best solution. Absolutely not. If you watch my content, you'll realize steroids can be very dangerous. Steroids may help short-term, but long-term, they break down tissue. We prefer safer options when the condition is controlled, like PRP and prolotherapy if injections are needed. Exception could be if your RA is severely active and you need one particular joint to calm down, in which case a steroid injection can still be helpful. And myth number four, surgery is your only hope if you have damage. Nope, that is not true. Again, many patients avoid or delay surgery with early treatment for the RA with disease-modifying treatment, also with regenerative medicine and smart rehab options. If you're newly diagnosed or think you may have RA, here's what you should do right now. First, don't wait, get evaluated early. Second, start with low-risk treatments, move more, eat better, sleep well. Supplements like omega-3 and vitamin D can help. Third, do not fear medications. They can protect your joints and reduce symptoms long-term as well. Fourth, explore regenerative medicine. If your inflammation is controlled but your joints are still unstable or painful, PRP, prolotherapy, or bone marrow cells may help. Finally, work with someone who personalizes in your care. Every RA patient is a bit different. You deserve a plan made for you. RA can be serious, but it's also highly treatable if we act early. During that window of opportunity, you can stop the inflammation, protect your joints, and live well for years to come. Even if you've already had joint changes, you still have options. Don't settle for, this is just how it is. You can still move better, feel better, and live better. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're dealing with RA and want a personalized, non-surgical plan, we're here to help. Check out our website, chicagoarthritis.com, to schedule a consultation. Thank you for watching. Take care and live well.